This episode is brought to you by Experis. Health IT is complicated. Finding the right partner doesn't have to be. At Experis Health Solutions, we deliver the expertise you need to modernize, optimize, and innovate faster, helping you improve patient care while maintaining a healthy bottom line. From advisory and implementation to optimization and managed services, we've spent nearly 30 years partnering with over half of U.S. health systems to drive meaningful transformation. Need a single expert, a full team, a tailored solution? We've got you covered. Flexible, scalable, and designed for your success. Experis Health Solutions, fueled by passion, measured by impact. Learn more at thisweekhealth.com/Experis.
I'm Drex DeFord, President of Cyber and Risk here at This Week Health and the 229 Project, where we're transforming healthcare one connection at a time. Welcome to this Solution Showcase, where we spotlight solutions that work. Let's see what's protecting patients and families today. Hey everyone, I'm Drex DeFord, a longtime recovering healthcare CIO and now the cybersecurity and risk leader of This Week Health and the 229 Project. I'll be your host for today's Solution Showcase. And first of all, to all the listeners, thank you for listening today. We always appreciate your time. And I'll tell you today, if you're trying to figure out the right way to manage continuous growth and M&A at your health system, I have a couple of folks here who have spent a lot of time building teams and building best practices around that problem. So I think you're going to get a lot out of today's Solution Showcase. Thanks to our sponsor today, Experis. Glen's with us today. You do continue to make this big difference to all your customers, so it's going to be fun to talk to you. We'll talk more about all of that here in just a minute. And I'm also really lucky today to be joined by one of my really good friends and fellow member of the Yellow Shoe Club, benefiting Alex's Lemonade Stand Foundation, and CIO at UNC, Brent Lamm. Welcome to the show, fellas.
Thanks, Drex. I'm glad to be here.
Yeah, good to be here, Drex. Thanks, Brent. Thanks, Drex.
And I appreciate the shout out for the Yellow Shoe Club. I've gotten a lot of street cred from my two teenage daughters for having those fantastic custom Air Force Ones.
Air Force Ones, they are the thing for sure.
Yeah.
Okay, so the best place for us to start really is probably with introductions. So Brent, let me start with you. Tell me a little bit about yourself and the work going on at UNC. I know you've been doing this CIO thing for a long time. It can definitely drive a lot of burnout. It can grind you down if you let it. So tell me about yourself. Where do you get the energy and the focus?
The energy and focus is pretty easy for me. It's all external. I have a phenomenal team of leaders that we have been very fortunate to have served at UNC Health for a long time. We've had very low turnover, which has been amazing. And as I always say, it takes a great team to really make up for the shortcomings of the CIO. And so I certainly ride on their shoulders every day. And then as I mentioned, my two teenage daughters, they certainly keep me young, at least young at heart, I can tell you. But so no, Brent Lamm, CIO, Chief Information Officer here for UNC Health System. We're a 18 hospital health system fully contained within North Carolina. We've got hospitals from the mountains of North Carolina all the way to the coast. We're very proud of our mission to serve all North Carolinians and all communities across all 100 counties of the state. We've got a strong focus on our rural healthcare populations and serving those populations as best we can. A lot of people don't know this, but North Carolina has the second largest rural population behind the state of Texas in the country. So that's really important to us that we're serving the rural parts of North Carolina as well. And as a big part of that, in addition to our hospitals and all of our physician practices across the state, we've got a very mature and I would argue leading clinically integrated network. We call that our UNC Health Alliance. We're in over 50 of the 100 counties in North Carolina, have about 8,000 total providers that are serving North Carolinians in that area, in that geographic area every day. And I'm just really proud of our mission to serve the state.
It's amazing to me. Glenn and I were looking at the North Carolina map and we were looking at all the dots that are on the map that are UNC Health locations. And I mean, it's kind of amazing the amount of blanket that you have over the entire state.
And in my role, I forgot to mention, I mean, and I'm lucky enough to serve as the Chief Information Officer. And we've been very aggressive with that map you're describing. We've been very aggressive about making sure that we have a single enterprise centralized function for all things IT, digital, data science, and now clinical engineering. And so we brought biomed or clinical engineering into our information services function as well. So we believe the 1+1 = 3 is doing this at that enterprise scale across that entire footprint of UNC Health.
Yeah. Okay. So I want to go to Glen, who has been working in healthcare. I'll let you, Glen, disclose how long you've been working in healthcare, but Glen's also a 229 Project Healthcare Certified Sales Professional, Solutions Professional, as we were talking about beforehand, HCSP. So it's great to see you, Glen. Tell me a little bit about your background. What's hot at Experis?
Sure. I appreciate it. Thanks for letting me be here, Drax and Brent. Good to be here with you guys. And thanks for asking what's hot. Normally for me, it's a cup of hot coffee, which I seem to have with me all the time, staying up late, way too late, waking up way too early, really doing what I love to do, which is my role is building solutions for our clients. So leading solution delivery for our organization. We're thankful to have over 650 partners, around the country that we do this with. And there's, about 20 plus years doing this with our partners, helping them really scale and grow across different initiatives. That's what I do and love to do. At the end of the day, a baseline of what we do is really build talent and managed services solutions to help our friends like Brent. So other CIO peers around the country scale and grow so you're not burning out your teams, right? And so that's what we do. At the end of the day, I love to keep business personal. Some people say it's not. I think it's ultimately personal. It's what we do in healthcare. And so really happy to be here with both of you guys and have a conversation.
Yeah. So I want to start, Brent, with the focus on growth. What is kind of amazingly rapid growth at UNC Health over the past few years? I think it maybe I kind of thought of it initially as growing pains, but I don't know if growing pains even kind of begins to cover the battle that we've seen you go through there over the past few years. 14 hospital acquisitions, hundreds of clinic integrations, 2,000 projects. Tell me about some of the growing pains and how UNC Health has kind of evolved over that time.
Yeah, no, I appreciate it, Drex. It's been a journey. It's been an exciting journey and one that I'm really happy to be a part of. And we'll get to it, I'm hopeful, probably in further conversation here. But Glen and his team have been huge partners for us to help us enable that growth journey we've been on. We started back in 2012. We had this idea that we had these hospitals in the Triangle region of North Carolina. For those who know North Carolina, that's the Raleigh-Durham, Chapel Hill area. And, they were really separate IT systems, separate IT teams, just completely, divergent in every way. And we started, let's pull all of those facilities in the Triangle together under one IT team. We set out to look for a single electronic health record platform. We, like many others, we set on Epic at the time. And we brought the Triangle components of UNC Health together back in 2014. And then really from 2016 to now, we have just been working to align with hospital and practice groups across the state, bringing them on in much of an assembly line type manner, really trying to build out a roadmap of how we bring them into our UNC Health environment. Obviously, the branding, the UNC Health brand, we believe carries a lot of weight in North Carolina, and we're very proud of that brand. And we want that to be a part of how we're serving it, but we want it to be meaningful, And so a big part of that journey has been making sure we implement our best practices, our IT systems, the way that we have in the Triangle, and really helping to bring everybody to a single enterprise footprint. And that's a struggle, right? There's always that, well, we love that application we've got locally. We love that, technology. And that's certainly one of the growing pains was really trying to enforce that enterprise scalability and enterprise approach to it.
Hey, Glen, I know Experis has been a big part of this. You've helped integrate those new hospitals and clinics into the UNC family. What are some of the biggest challenges that you and Experis have seen as you've gone through this with Brent?
Sure. Yeah. When you're growing that fast at that scale, 14 hospitals, hundreds of clinics. When I look back at the history, I think about two things. I think it's scaling both people as well as the processes that go with that. Those are certainly critical aspects. Some people might think it's just about technology. It's not about just flipping the switch, I don't think, or just plugging in something new. It's what I've seen Brent and his team do really well is really aligning cultures, workflow, and then leadership, right? When you have two different organizations coming together, building those relationships. So I would say the three things if I come down to would be timing of some of those initiatives, early and often communication, capacity. So Brent and his team do a great job of really looking at that early to see how that's going to work. And then to me, I think the most critical in any success is going to be transparency within both organizations, within a partnership. And Brent and his team have done that exceptionally well. And I think bringing us in, thankfully, early in the process to help be a part of building that playbook, to me has been invaluable to make it repeatable and scalable as they grow.
I think Glenn nailed that. I think what he and his team have brought to the table for us have given us a lot of confidence as we get more aggressive on what that roadmap can look like in terms of how much we can actually accomplish within a fiscal year or calendar year type approach, and the ability to be able to know that we're going to get, high quality talent to bubble up quickly through Experis and Glenn's team. That's been a huge advantage for us to having a lot of confidence, say, yes, we can go and bring that organization in quickly and effectively. And one of the things that, if I could comment very quickly, one of the things that Glenn's team does that we haven't really experienced elsewhere, and I think it's one of the things that really helps them differentiate themselves in the marketplace, is Glenn and his team actually work hard to bring back the same resources from one UNC project to another. So we've got a lot of familiar faces when we're doing one go live or one, infrastructure migration project to another. He and his team are bringing those same resources back to us. They know our environment, they're familiar with our epic build, et cetera, and that makes a big difference.
You kind of referred to it when we had talked earlier. You had a cloud analogy that you had used. You want to talk about that?
Yeah, sure, absolutely. So, one of the ways that our team think about our partnership and relationship with Experis is similar to that sort of on the technology side. We think one of the benefits of cloud is you can bubble up immediately and quickly as you've got more workloads that need to occur in a very short period of time. We feel that same way about what Glenn and his team bring in terms of human talent. We know that we can bubble up quickly because he's going to bring those resources when we need them. They're going to be high quality, and we're going to be able to do that bubbling and bubble back down quickly and really be cost effective as well.
The other thing I wanted to ask you about, Brent, was so it kind of started this big and then it kind of got bigger and bigger. You added more and more things over time. I know, talent solutions, consulting support, managed services, kind of growing that IT leadership capacity, but adding new and different kinds of projects than what you originally started with. How important has that been in supporting the growth speed that I think the business has wanted to achieve, along with you being able to support them to go as fast as they want to go?
Yeah, it's huge. And I will say a couple of examples there, like for example, it's a big effort, big lift to consolidate all of the different legacy applications and Active Directory to Microsoft domains when we're bringing an organization into UNC Health, and being able to have resources like Glenn's team to be able to throw at that quickly and get that done, because we've got to get that work done before we can unlock all the capabilities of our enterprise investments for that community that we're bringing into UNC Health. And so that's a huge asset and huge benefit for us. And another example is when we rolled out our enterprise-wide enterprise resource planning system, being able to have Glenn's team there. We have one ERP instance and system for the breadth of UNC Health that supports 9 different payrolls, because we still have some different local community payrolls requirements. For those who know this work, you'll know what I mean.
If you know, you know.
That's right. And to be able to have sort of, at the elbow support and project management, project planning support for that kind of implementation, where all of the different heterogeneous aspects of different payrolls, benefit plans, et cetera, and being able to have talent that can help us navigate that quickly as we're rolling that out from one entity to another of UNC Health. That's a huge advantage for us to be able to meet the demands and the needs of the business.
Hey, Glenn, the infrastructure part, because I know it's not sexy, but it is absolutely necessary. We talk about this often as kind of Maslow's hierarchy of needs and that bottom layer that has to be squared away before you can do all the other cool stuff. How have you kind of helped influence and manage those kinds of projects through the growth that you've seen at UNC?
I love the question, Jackson. Brent, thanks for what you said. It's all of those things. It is one of those things, right? Where we look at it as that infrastructure is the foundation of every successful healthcare IT project that we've done and probably will continue to do. It's the whole, what are you building on top of your foundation? And if that's not right, well, we know how the story goes. So, and yeah, you're not going to see infrastructure on the billboard, but it'll be the things that power the billboard that, says the AI. That makes sense. But we look at it as, technical debt within organizations can be one of the things that actually limits the M&A opportunity and the speed at which you can do that. Whereas what we've seen with Brent and his team and some other partners is, they're using that as a true strategic enabler for them to be able to make some changes and to move as fast as they want to. So we can use launchpad of innovation, however we want to say it. My word lately, because it's the season, is the offensive line, right, of projects. Does not get talked about. It's not flashy all the time. If it goes well, hey, it's great. But if it doesn't, the franchise quarterback's in trouble. We're not winning and nobody's happy. So perfect question.
All this gets back to something else that is probably worth talking about too, and that's trust. And it's the trust that I think the two of you have for each other, but that your two teams have for each other. But it's also just kind of the trust that winds up being built. And a lot of this is because you do it and you do it and you do it and you trust each other. You don't have to spend a lot of time even talking about decisions sometimes because you know what the other team is thinking, you know where the other team is. Talk a little bit about trust. This is for both of you.
Yeah, I'll just start real quick and just say we've got another organization that we're very soon going to be bringing into the UNC Health environment. And, we can have at this point a quick call with Glen and his team and say, hey, and they know the plan. They know the play. We stick with the football analogy here. They know the playbook, right? They know, what plays we're going to run and what we need to get done. And so I think that just speaks to the trust that we've built over time, that there's no question who we're reaching out to. It's just like, at this point, it's just a habit. Of course, we got to call Glen and get his team roped in and hopefully pull them in quickly here to get us started down this journey.
I think, when I hear trust, I think for both teams, it's a both and is, just showing up consistently, right? And sounds simple, but hey, if you say you're going to do something, no matter how small, actually do it, is what I think has been really successful. And I call it the 2 a.m. call. It's not always when things go really well that you build trust. You don't build it on the mountaintop, ringing the bell. It's those other times. So it's, who are you going to call at 2 a.m.? Are they going to pick up? And then when they do, are they actually going to do something with that call? And I appreciate that. I feel like we have that on both sides, and we have that with many of our partners, and very thankful for the relationship.
That's great. I had a really good boss one time who said, nobody's perfect, but the differentiator is what happens when the bad thing happens. Like, how do you perform when that happens? That's the thing that really makes the difference. So I like that point. Hey, Brent, what's next? What you kind of gave us a hint. Something new is coming into the family, but where do you go from here? What's up next?
In terms of what's next, I think for everybody right now, we've gone this far without saying AI, but we've got to bring it into the conversation because it's, certainly what's going to be, enabling a lot of what we do. We're in the process right now of sort of reorganizing our information services division that I have the privilege to lead. And we're trying to think strategically about how an information services organization needs to look and operate in this future of AI. And these are not really that exciting or sexy, but terms. But we've kind of been thinking about things really in 3 buckets. It's AI for teammates. So teammates, what we call all of our providers, employees, staff, et cetera, across UNC Health. And like, how can we give them the resources and easy access to web intranet portals, et cetera, easy access to the tools that they can use to be the most productive in their daily work? How do I self-guide my day and take advantage of all these capabilities? AI for operations, where we're trying to figure out how we can automate and streamline to try to address patient access challenges that we've got. operational efficiencies. Everybody's trying to drive down costs. We're no different. And then, AI for science. We're a large academic research organization, health system, and we're very proud of that. And we've been very fortunate to have just wonderful faculty that have been done amazing discoveries over the years and played, critical role in the advancement of medicine in the US and beyond. And we know that the game is changing there now with AI. And so we've got to give them the AI tools to be able to take advantage of these capabilities and more quickly analyze data in different ways using AI than they could before. And hopefully we're going to see, faster speeds to breakthrough discoveries.
Glenn, I kind of want to give you the chance to ask Brent kind of a final question here. We're kind of winding down.
I got it. Yeah. Thanks for the opportunity. Hey, Brent, one last thing. So if you take today, right, things that were said, maybe things that weren't said that you didn't get a chance to do, what would be something that you'd like the audience and maybe even us to know, and share before we end today? What would that be?
The thing that comes to my mind, we haven't talked about it here, and it's talked about a good bit in our broader community that This Week Health team does a great 229, does a great job of helping with. But, a burnout and well-being of our teammates it's a real issue in healthcare. It's talked about quite a bit, but it's something that we're really focused on trying to improve experiences for our teammates. And we're working very hard to do that with, ambient AI deployed now across our organization, all the Epic, efficiency tools. We've been aggressive in trying to deploy those. But one of the things we don't talk about very often, and I'm very proud of the work that the team has done, is we partner with an organization that's helped us to arm our nursing leaders with really advanced AI and some non-AI capabilities that allow them to really do a much better job to automate communications, celebrations, just general engagement with their nursing teammates. And we've seen this dramatically improve scores and engagement at results. And we've been tracking nursing turnover. I mean, and bottom line is we estimate that we've saved about $5.4 million in the past year and a half by reducing nursing turnover. And that's a quantified number that everybody can kind of get their hands around. But I think the broader thing is we're working hard to make UNC Health a place that really attracts the best nursing talent. We really want nurses to be proud of working at UNC Health and really just looking forward to, working in our organization. And so we're very proud of that work.
I feel like we could just go on and on. There's so much stuff to talk about. We barely touched on AI. I thought we would make it through the whole discussion. I'm just kidding.
I'll pay my donation if we need to.
That's right.
There's a drinking game here somewhere. But thanks to both of you for being on. I really appreciate it.
Yeah. Thanks, Drex. And thank you, Glenn, for the continued partnership.
Hey, thanks to Experis for sponsoring today's Solution Showcase. I'm Drex DeFord from This Week Health and the 229 Project. And as always, thank you for being here and listening. If you want to know more about what we're doing and where we'll be, go to thisweekhealth.com/subscribe. We'll keep you posted on webinars and podcasts and city tour dinners and summits and our new city staff roundtable schedules as we travel through the U.S., transforming healthcare one connection at a time. Thanks again for listening. We'll see you around campus. Thanks for watching this Solution Showcase. We believe every healthcare leader needs a community to lean on and learn from, and that's especially true in healthcare. Join our community by subscribing at thisweekhealth.com/subscribe and share this with your best friend at work because together we're stronger.